So he is an unvaccinated person in the world of Delta. On the other hand, this is what I do to keep him safe. Number one, he is at much lower risk of severe disease. That is just a truism. Healthy children are much lower risk of severe disease. If he were immunocompromised, I'd be very, very much more protective of him. Second is I'm masking him. So he is wearing a mask. We were all getting lax when I didn't have to wear it as a vaccinated person. Now he's back to wearing masks in indoor settings along with all of us. Third is that he can go back to school. He should go back to school. And that is important because I think we all saw the mental health effects, the learning loss, the eating disorders, the prolonged school closures. We're going to look back at this time and not think that was the right thing the United States did, or especially California, because UK and Europe didn't do it and they kept children in school.
Welcome to the Good Life Coach podcast. I am your host, Michelle Lamoureux. The intention of this show is to awaken you to your fullest potential. Join me each week for inspiring interviews to elevate an area of your life, as well as interviews with women entrepreneurs who are creating success on their own terms. Each episode provides actionable tips to guide you to design a life you love. Hey there, it's Michelle, and welcome back to the show. I'm thrilled to let you know that joining us today is an infectious disease doctor who is going to give us the update on the Delta variant, what we need to know, and ways to mitigate risk for ourselves and our families. Joining us is Dr. Monica Gandhi, an infectious disease doctor, professor of medicine and associate chief in the Division of HIV, Infectious Diseases, and Global Medicine at the University of California, San Francisco. She is also the director of the UCSF Center for AIDS Research and the medical director of the HIV Clinic, Ward 86 at San Francisco General Hospital. Her research focuses on HIV in women and adherence measurement in HIV treatment and prevention, and most recently on how to mitigate the COVID-19 pandemic. Dr. Gandhi does such a great job of taking all the data that's out there and letting you know what's really going on without all of the fear, which I think is really important because anxiety is already high enough for all of us. And before we get started, I just need to note that this interview is not to be considered medical advice. Any decisions you make for your health and well-being should always be discussed with your doctor and trusted healthcare provider. The show notes for today's interview, along with a link to Dr. Gandhi's Twitter handle, can be found at thegoodlifecoach.com/141. On that note, let's get into the show. Here we go. Welcome, Dr. Gandhi. Thank you for being here today. I'm honored.
Thank you.
So you're the voice of reason that I turn to on Twitter. I'm not even on Twitter except to follow you. This is
Thank you.
Yes, because the data you put out, when I hear all the fear mongering and all the different data, I come to you and then you've already synthesized what's buzzing. So I want to talk to the people, to help the people who are vaccinated understand what's going on. In terms of what's buzzing, I happen to be in Boston. As you know, in Provincetown, around the 4th of July weekend, there was a spike. Massachusetts is the second most vaccinated state, yet now we're a hotspot. Tell us, where do we stand with Delta and its efficacy? What can we discern from what's actually happening in some of this data that's floating around right now?
Yes. So, I think that last week was sort of a disaster for public health messaging because I think we didn't cut through that noise and say cleanly what happened in Provincetown. So, for example, there were a lot of people who descended on Provincetown. July 4th is a very fun weekend, very traditional weekend for a lot of men who have sex with men, lots of fun. And there was a lot of inside activity. There was a lot of windows closed. There was intimacy. All of that was going on. And so it isn't exactly the most generalizable situation to like you and, being in a store or you having dinner with your vaccinated friends, or it really wasn't that generalizable. And unfortunately, there was a lot of lessons that we're taking from it that we couldn't put out as generalizable. The breakthrough rate with Delta is not 75%. We definitely see breakthrough infections with Delta, which I'll explain, but it's likely not that high. And in fact, Dr. Fauci yesterday told us the absolute number of breakthrough infections is going up, but the proportion is probably staying the same in terms of, it's just that we have so many more people vaccinated. These breakthrough infections are mild. The most important thing from that Provincetown outbreak is it was a stress test, like you won't believe, like all these people inside, like lots of stuff going on, mixed vaccination and unvaccination, because yes, the Provincetown vaccination rate was high, but there were people coming from all over the world, all over the country.
Yes.
There was still such low rates of severe illness in those who got the Delta variant. And in fact, there were about 3 people who were vaccinated who went to the hospital, and then they came out pretty quickly, no deaths. Really amazing power of the effectiveness of the vaccines, even under stress tests, of preventing severe disease, hospitalizations, and death. And that is the first thing I would have said out of that Provincetown outbreak last week. As the message that I got. And then there are a couple of other messages. Yes, this is more transmissible. Yes, this is more contagious, the Delta variant. Yes, that it can spread from those who are having mild breakthrough infections. And so that's why, to me, putting back masks for this temporary period of the Delta is totally understandable, is totally the right thing to do, because why should we even get mild breakthrough infections? And especially since this is so contagious. But the ultimate message was not that the vaccines failed. They did not. They do not fail. They work. And the ultimate message to me was, let's do everything we were trying to do to get vaccine rates up in our country.
Completely. And that's, I guess, why I was partially concerned, because that messaging then goes to people, oh, the viral load's the same in vax as unvaxxed, and 70% got it. But like you're saying, this was a unique situation.
It was a unique situation. And what you just said, the interesting thing about what you just said about viral load being the same.
Yes.
Is so vaccinated people, unvaccinated people, at one point in time, the cycle threshold of the test, the PCR test, looked to be the same. There was just a Singapore study literally the next day with Delta breakthrough infections that showed that, yes, the viral load by the CT value was the same on one day, but it came down more quickly in those who were vaccinated. Why? Totally makes biological sense. Your immune response comes in, fights that virus, brings it down. So you're likely not as infectious if you are vaccinated than you are unvaccinated. It's probably a shorter period of time. And the vaccines will bring down that viral load. So we don't want to equate one point in time with infectivity. And also they didn't culture the virus. So there was just too much messaging there that got so scary, I think. And it shouldn't have scared the vaccinated. The vaccinated should feel great that they got vaccinated. It should make the unvaccinated want to get vaccinated, because they are so effective at preventing severe disease and hospitalizations.
Thank you for clarifying that. And I'm actually going to state the date, because since the data is changing so quickly, August 3rd, 2021, we're doing this interview.
Yes, good point. Yes. And the Singapore study was one day after the Provincetown study, literally just the next day. So
July
30th was the Provincetown study, or July 29th, and July 30th, we got the Singapore study.
Perfect. Do we know the efficacy? I mean, are we putting numbers? I've heard anything right from the Israel study from 67%. I heard someone out of Brigham and Women's today saying it's 75%. I've heard 95%. Do we know, or is the data really not clear?
Well, it actually, in a way, depends on where you are in the world. And I think that's a really... Okay, so let me explain that the fact that in the UK, the effectiveness of the vaccines that we use in this country are 88% against symptomatic infection and 96% against severe disease. And we can safely say in this country that the effectiveness against severe disease is even higher than 96%, because those who are in the hospital, who are hospitalized right now, are the unvaccinated at about a rate of 99% to 1, meaning most 1% of people who are vaccinated are in the hospital right now after a severe breakthrough, whereas the people in the hospital right now, 99% of them are unvaccinated. Wow. So we know the effectiveness against severe disease is still extremely high, approaching, about 99%. However, the level of effectiveness against symptomatic infection, like getting even a mild breakthrough infection, I think depends on how far you are from your vaccine. And Dr. Fauci actually talked about this yesterday at the task force briefing, that in Israel, they started vaccinating earlier, and there are more mild symptomatic breakthroughs at about 64%, whereas the UK, it's 88% against symptomatic breakthroughs. That is likely because they've been longer since their vaccines.
Yeah.
Antibodies will go down in your nose, not because there's anything wrong with your immune system. That's actually a normal, non-glitchy, it's what your immune system does. It does lower your antibodies in your nose. It can't hold all your antibodies. Otherwise, your blood would be so thick of protein. But as your antibodies go down, in your nose, you are more likely to get a mild symptomatic breakthrough. 2 ways to prevent that. Actually, 3 ways to prevent that. One is to mask, easiest, simplest way, and that's what we're doing. And that was the right thing to put back. Second way is there are nasal vaccines that are coming out that will actually stimulate the immune response right at that level we need it.
Wow.
The nose, so that we combine our systemic vaccine with the nasal vaccine, then we have good nasal antibodies, and then we also have good systemic vaccine. The third way is to get transmission down, period, because you are not going to be exposed to a mild symptomatic breakthrough if we can get transmission down in our country. Yeah. And the way to get transmission down fundamentally in our country is to get more people vaccinated. Yeah. It's why transmission is super high in places with 30% vaccination, and it's not as high in places with 67% vaccination. I mean, it's really tracking with areas of the country where there's less vaccination. So the ultimate solution to getting the fact that your antibodies are down lower in your nose, which is natural from the vaccines, to not get infected, is to bring transmission down. And the ultimate solution is always going back to getting more of us vaccinated. The White House keeps on saying this. That's what we need to be doing right now. Right. But the conversation is going to passports. It's going to requirements. You can see the swing in the conversation in this country. How do we break through the lack of vaccine uptake at the high level that we needed to be? So those are the 3 solutions not to get a mild symptomatic breakthrough. And the one that's totally under your control is wearing that mask.
Is wearing the mask. I love that. I love tangible things that we can do or to
exactly.
Do we have a number? Are we still shooting for herd, or is that not? I mean, what is that number in terms of what percentage do we need across this country? And does that actually include people who have had a case? Are we tracking those numbers?
Well, this is a very good question. So, the concept of herd immunity is that we get to a point where we have so many people vaccinated or immune that we protect the unimmune, right, who can't get vaccinated yet, like children. That number was really at a better point with Alpha variant. It really, 70% was really where it was. We thought that we could get to herd immunity with 70% vaccination. And now, unfortunately, the Delta variant has moved up those numbers once again. Mm-hmm. And it's going to be more like 80%. So, 80, even 85%, something much higher. That is a very huge disappointment about the Delta variant. It's so much more transmissible. So that is disappointing that our herd immunity numbers went up. On the other hand, the one thing that I can say about the Delta variant is going back to what you just asked. What about people who've had natural infection? People who've had natural infection are protected against reinfection. There are multiple ways to say, okay, if I've been naturally infected, how do I know that I have good immunity? You can look at antibodies, which they do have. You can look at T cells, which they do have. But fundamentally, the clinical correlate of the durability of natural infection is, do they have the same rate of reinfection as vaccinated people do? And frankly, the answer is yes. They do have the same low rate of reinfection. And there's some evidence from Israel that the 9% of the Israeli population who's had natural infection are not getting mild symptomatic breakthroughs with Delta as high of a rate as those who've been vaccinated. Mm-hmm. Because your antibody responses are very complex and in breadth after natural infection. And there was just a study in bioRxiv this morning. This is how fast data moves. Yes. You've had natural infection and that your antibodies are robust and they sort of become mature and differentiate with time. So going back to this question of natural immunity, well, yes, I believe natural immunity, of course, combines with vaccine-induced immunity to give us our herd immunity threshold. And the one good thing about Delta, I'm not saying I ever want a Delta happen, is that it will get more of the unvaccinated people immune. Tragically, some of them become immune through hospitalization. Tragically, some will die, which is happening right now, preventable deaths that didn't need to happen in our country since we'd had the vaccine. But those with mild disease, yes, they will get natural immunity from against SARS-CoV-2, and that will add to our overall level of immunity. And what are we seeing in the UK? That's what we're seeing. We basically saw the cases plummet, not because they closed down society, right? Because they actually opened society on 19th of July. They stopped all restrictions in the UK. About 7 days later, the case started plummeting. You can't attribute that to mass distancing, ventilation. You can't. They just opened. Right. That is being attributed to natural immunity, that those who had not yet had the possibility of getting the vaccine, who were younger, had mild infections, and they got, many of them got mild infections, and they got immunity. And that higher level of immunity in a population does bring the cases down. And so I'm not calling this a silver lining. I hate the Delta variant, but I do think it will make those who have declined to be vaccinated, it is finding them because it's so accessible, and it may make them immune.
Yeah. Well, let's talk about kids then, because I think there's parents who are concerned about either passing it to the kids, even if they're double vaxxed, fully vaxxed, I'll say fully vaxxed, or, that they're going to be exposed in some way. What are your thoughts in terms of children and vaccine? I saw something you posted. You did vaccinate your son, but obviously then people are weighing the risk of myocarditis. And then I know one of your colleagues, I believe, Dr. Prasad, wrote an article about maybe one dose. Like, what are your thoughts? I'd love to get your input.
I'm so glad you're asking me this, because in a way, I'm the perfect example of what you should do with children, in a way, because I am a infectious disease doctor. So I know a lot about the vaccines, but I also happen to have a 13-year-old and an 11-year-old. So I have one that was qualified to get the vaccine when we opened it up to 12 and 15-year-olds. And then I had one that is not yet can be vaccinated. So I can relate to these fears and concerns that parents are having, that those who are less than 12 can't be vaccinated. We have the Delta variant. So I can explain my line of thinking, even in a personal way. The 12 to 15-year-old, in this case, the 13-year-old, I did give him his full course of vaccination, which was 2 shots. I, too, was concerned about the rare but real cases of myocarditis that were occurring among young people, and it was especially young men, young males, after the second dose. So I actually did end up delaying his second shot from 3 weeks to ended up giving him at 6 weeks. And I was balancing lots of things. I was balancing the fact that Delta had come in, so I wanted to give him his second shot, and then the rare cases of myocarditis. Because I have the advantage of talking to a lot of physicians and pediatricians, I really became reassured that these cases of myocarditis are very rare, but also very mild. Like, people at the beginning were hospitalizing people because they were worried, but they went away really quickly, and people did really well. Kids did really well. So because of that, I felt very comfortable, and I have given him the full course of vaccination, the 13-year-old. Okay, now going to the 11-year-old. He can't be vaccinated. He just can't. I mean, I could lie and say he could go vaccinated, but he's really tiny. And I actually don't want to give him a 30 microgram dose, because I'm waiting for, that's the Pfizer vaccine dose for adults and 12 to 15-year-olds. And I'm waiting for the clinical trial data, which will be coming in October for 5 to 11-year-olds. And I do think it'll be here by October. They actually just expanded the trial because they wanted to make sure there weren't side effects. The FDA said to Pfizer, hey, can you expand it from 2,200 to 5,000 kids, 5 to 11, to make sure that we rule out rare side effects? And they said yes. So it is going to delay the trials. So he is an unvaccinated person in the world of Delta. On the other hand, this is what I do to keep him safe. Number one, he is at much lower risk of severe disease. That is just a truism. Healthy children are much lower risk of severe disease. If he were immunocompromised, I'd be very, very much more protective of him. Second is I'm masking him. So he is wearing a mask. We were all getting lax when I didn't have to wear it as a vaccinated person. Now he's back to wearing masks in indoor settings along with all of us. Third is that he can go back to school. He should go back to school. And that is important, because I think we all saw the mental health effects, the learning loss, the eating disorders, the prolonged school closures. We're going to look back at this time and not think that was the right thing the United States did, or especially California, because UK and Europe didn't do it and they kept children in school. So, but going into the school with Delta, I would want, and I'm going to get in the state of California, mitigation procedures. So children will be masking and there will be ventilation. Now, should those come off? Yes, they should come off with time. And that's the other thing, is we're having this conflict in this country. I don't want my child masked. I want my child masked. In my mind, there's a compromise for both those positions. Yeah. Going into the school year with the Delta variant, we do need these mitigation procedures. We do need masks. We do need ventilation. But if you do metric-based approaches, like a number of when masks come off, of when you don't have to do the distancing, if you don't have to do this, people then have an endpoint to look forward to. Oh, when we get back to low case rates in our community, low hospitalization rates in our community, then the mask can be optional. And some of us will choose to mask our children. Some of us will choose not to. But if we don't do metric-based, we're going to have a huge division in our country of people who want the mask, people who don't want the mask. And the other thing I liked about the CDC last week is they basically acknowledged that point and went to a metric-based system. If you're in a place of high community transmission, mask. If you're in a place like Vermont, you have low community transmission, by their parameters, you don't have to mask if you're vaccinated. Metric-based will get us to a compromise we need in this country.
This is so good. And what do you think about one shot? There was that study out of Israel that I saw too, that one shot was, it said, now this was back in June or May, 100% protection to youth. And that it says both because the second dose adds relatively little, if any, immunogenicity, and we know that for some young people there could be complications. So I just was curious.
No, so that actually at the time I thought that was really good. So what they ended up doing is in the Pfizer actually went back to their 12 to 15-year-olds and they said, actually, what was the level of protection after just one shot? Yeah. And it did look like 100%. There were only 18 kids who got COVID in that entire trial of about 2,300 kids. And of all 18, they got it in the placebo group. All of them got in the placebo group, and they were all within the parameters of one shot, meaning that's why Pfizer went back and said, it looks like one shot is enough to protect you against the Alpha variant. That's the trick, though. That was the Alpha variant. And that study was done in the context of the Alpha variant. The issue about the Delta variant is even though 2 shots are extremely protective against severe disease, it does need both shots to get your antibody levels up to full protection against at least symptomatic COVID. And so that's exactly what made me change my mind is I was doing one shot with a 13-year-old. Delta comes along. I was actually always going to give him 2 shots, but I was going to wait. And then Delta comes along, I put it all together and I say, okay, fine, I'm giving him a second shot. So we have to remember that things change in a risk versus benefit analysis with COVID all the time. This is what's so painful about COVID and hard that things keep on changing. I don't actually think the CDC was wrong to take off masks for vaccinated on May 13th. I thought it gave a lot of people hope. I thought unvaccinated people vaccinated, some of them vaccinated. But then the data changes and then there's more transmissibility with the Delta variant and then they come back. If we had to accept and be humble with the SARS-CoV-2 virus, that data and recommendations are going to change.
Yeah. Let me ask you, what happened to the flu? Was that a case of interferon? And I don't know I don't have a medical background. I read something about that. Can you talk about this? And if interferon was a contributor, can you explain what that is?
Yes. So though I don't actually think it was that. I think what happened with the flu is that masks and distancing and staying away from each other does reduce all infectious diseases. We just have to decide, and including the influenza. And these masks are likely even more effective against influenza because it's more what we call droplet spread. Yeah. And the bigger virus or comes with like stuff around it that makes it bigger. And so cloth masks are likely very effective. And so influenza, and then we all stayed home when we were sick. I mean, people wouldn't even go out the door if they felt sick these days, whereas we used to go out and work when we were sick all the time.
Right.
So I think all of that made the flu essentially go away. This is the problem. We could avoid all colds and flus with mask distancing, social isolation for the rest of our lives. Right. That is not a way to live. And the reason that's not a way to live is there have been other consequences, clearly, of all of this keeping away from each other. Social isolation is very real. Mm-hmm. Mental illness is really real. Depression, anxiety, all of that. And so when I think about what to do for influenza as an infectious disease doctor in the future, what I think is no one should ever be coming to work again when they don't feel well. We used to do that. Doctors used to do that. They would take Tylenol and they would just come in. We really need to learn that culture of if we don't want to spread infectious diseases, of staying home when we feel unwell. Usually colds and flus are more infectious when you feel unwell. And so staying home when we feel unwell. And I think that's what will cut down on our influenza rates.
Absolutely. And RSV started to circulate too, right? Because there wasn't as much exposure because everyone was masked. So there's
Exactly. And RSV, that's exactly what happened. We all got colds in June, the minute that we took off our mask on May 13th. Everyone got RSV. There was a lot of RSV. That will happen. We are exposed to pathogens. The one thing I will also say is if we avoided all mild pathogens for the rest of our lives, that is not good for your immune system. It is actually not good for what's called microbial diversity in your body. There's something called the NIH Microbiome Project that shows that actually staying away from all mild pathogens will reduce your immune diversity, and you're not able to fight allergies, autoimmune diseases, and even cancers. So, it's not the best time to talk about like mild pathogens and colds because no one wants to even think about getting a cold right now with all these breakthrough COVIDs. But there will be a time where we can't avoid all pathogens. It's not the right thing for the human species.
Absolutely. How do we get to endemic versus pandemic?
Yes. So I think the Delta variant has really proven to us that we're going to be what's called endemic, unfortunately. Now, I know there are people who still think we can eliminate COVID-19. I think the incredible transmissibility of this particular variant doesn't mean we can eliminate it, but it does mean it can become endemic. And what does endemic mean? Endemic means that you learn to live with it, but it neither closes down society, nor does it cause high rates of severe illness. That is what the vaccines have proven to us, that they can take it away from a terrible, scary, awful virus that causes high rates of severe illness, and that they can take it down to what the other four common cold coronaviruses do, which can cause mild infections, but does not close society. It's called defanging. I call it defanging the virus. And that is what these vaccines are doing. If we could get everyone vaccinated, more people vaccinated, it's defanging the virus. So it will come with other respiratory viruses, but if we're vaccinated, it will keep it at that low level, not life-threatening, low level sort of respiratory viruses like the other four common cold coronaviruses, and we'll learn to live with it. The other thing that it will do is in communities that don't vaccinate, and there are some communities in our country that have always had measles outbreaks or other outbreaks of diseases that we thought we had under control. Yeah. If you decline to vaccinate, there can be severe disease in those communities, and then you rush into those communities, beg people to get the vaccine, and also treat.
Yes.
Which we're going to have treatments for this.
Absolutely. Where can people learn more about you, follow you? Should I give them your Twitter handle? Is that
yes, I don't like tweeting, but I have tweeted in this pandemic. I'm going to do it until the pandemic gets better, but then I am actually going to get off Twitter because it takes a lot of time. But it is Monica Gandhi 9, at sign Monica Gandhi 9.
I will put that in the show notes. I am so grateful for your time today. This was so helpful. And I think also going to be very reassuring for people who are concerned. So we should be masking indoors.
Yes.
Indoors.
Yes. Indoors. Outdoors is still very safe because
that's what I was going to ask you. Is it safe? Now
it is because this virus dissipates very readily in the outside air. Ventilation is one of the meanest things you can do to this virus. One of the best tools we have. And so there has not been any, and remember, Delta's been in India since the beginning of March. So it's not like we don't have experience with Delta. There hasn't been clear links to outside transmission. It really is kind of an indoor, doesn't like the indoors. So I think masking back indoors is the absolute right thing to do.
Okay. Thank you so much. You've been so generous with your time. This has been fantastic.
Thank you so much.
Thanks so much for tuning in today. I hope you gained some new information or inspiration for your life. That the essence of this show is to really wake up to what's possible for you, to reclaim your beautiful voice, and to really learn to love and prioritize yourself. So if you gained any value from any of the conversations you've tuned into, make sure to subscribe on your favorite podcast player. You can do that right now on your phone. And please do consider leaving a rating and review if you have yet to do so on Apple Podcasts. It's actually how more women can find the show. And I really want to grow a community of women who are loving themselves and living full on. So thank you as always for tuning in. And I look forward to reconnecting with you next Wednesday. Bye for now.